Welcome back to the morning show here on ABC News Radio, KMET 1490 AM. With Mia, Brett, and myself, Aaron Michael Sanchez. And we have come to that point in our time where we need to talk about something very serious. And that is on the subject of prostate cancer. But we're not just going to talk about prostate cancer, what it is. We're going to talk about how we can get rid of that bad boy and still be healthy with that. That's right. We have Dr. Michel here with us. Doctor, welcome to the show.
Thank you so much for having me.
Absolutely. Okay. The first question out of the gate comes from Mia. Mia, what was your question?
I wanted to know, where is the prostate?
So the prostate is located just below the bladder and just anterior or right in front of the rectum itself. And because of that, it's easy to check with just a simple rectal examination. We can actually feel the prostate.
And so is it basically inflamed when the doctor goes in there and he feels for that, or what is the doctor searching for exactly when he does do that?
Yeah, so when
which is not fun, by the way. I'm going to throw that out there.
Yeah, so when a man actually goes in for a prostate examination, it's due to a few different things. But when they're going in for prostate cancer screening, essentially what we're feeling for is we want to make sure that the gland itself is symmetrical, that the consistency is very normal, so there are no hard spots, and there are no irregular borders, no nodules, no growths on the prostate itself.
Well, you know what? You know how they tell women to check and examine their breasts for detection of breast cancer, to feel around? Do men have to do something similar, or is it something only a doctor can find?
It's going to be physically difficult for somebody to really check themselves, so you really need to see a physician. And we recommend that men get screened starting at the age of 40, depending on what the risk factors are. And then going forward over the age of 50, it should be performed at least on an annual basis. Because we've clearly shown that if you're able to detect prostate cancers in their earlier stages, the cure rates are much, much better.
And does it matter if you have a history of it or not, or is it across the board, men 40, go get it checked?
Absolutely. So the men who are at most at risk are gentlemen who actually have a family history of it. So if their brother or father or grandfather has a history of prostate cancer, they should get screened earlier. African-American men have a higher incidence of developing prostate cancer and also more aggressive types of cancer, so we strongly recommend that they do it. But when you think about the screening test, it is so easy. It's just a rectal examination. It literally takes about 3 to 5 seconds to perform, and it's a blood test. And that simple thing can just change someone's life through the screening methods. So we strongly recommend for men to get themselves checked at the age of 40, because if their PSA is very low, they can just get one more test by the age of 45 and then again by 50. When you look at populational studies, the highest incidence of prostate cancer occurs over the age of 55, but we see a lot of men in their early 40s that have prostate cancer. And we've been fortunate enough that because of their screening, they're now cured of it extremely well. Had they waited for the general recommendations for these men, it would have been too late.
Well, and again, I've had this rectal exam. I think it was in my physical that I had. And again, if anything, it's just it's a little uncomfortable, embarrassing just for the patient, but so necessary at the same time. Like, if that's going to keep you from checking this out, don't let that be, the reason that you don't get it examined. But my question is really, why is it 40 and above and not 40 and below? Like, why does it seem to hit around that time, if it does hit at all?
Good question. So I think there are two questions there. One, the incidence of prostate cancer below the age of 40 is relatively low. And I think what you're asking is, why do people develop prostate cancer to begin with? And different organs, the way that their maturation occurs, the incidence of cancers just varies. So, for example, thyroid cancer can occur in younger patients, testicular cancers in younger patients. Prostate cancer just happens to occur more in the kind of fourth decade and above. And each decade of life, the incidence of prostate cancer actually goes up. So the likelihood of a 50-year-old man or a 60-year-old man or a 70-year-old man to develop prostate cancer continues to go up. Some of that is definitely dietary, because, for example, when we take a look at an incidence of prostate cancer in Japan, it's very low. But if you actually take Japanese men and bring them to the United States and you feed them our diet, within one generation they have the same incidence. So there are certain variables. Yeah, it's really that powerful. And that tells us that there are also preventative things that we can actually embark upon to minimize our risk to begin with.
And what are those? What are those? Like, what? I'm already thinking. Okay, what is it that I need to stop eating, or
what is it they're eating?
Do I need just a Japanese diet now? Exactly.
Yeah, we all need to move to Japan.
Exactly.
So a lot of it is
by the way, Tokyo is on my bucket list, and now even more of a reason to do so.
Definitely. So a few things. One, to stay as close to kind of plant-based diets, that's going to be very, very healthy. So some of the known information that we have in regards to diet, which is cut down on your meats, cut down on dairy products, cut down on fats, and what's essential is for men to try and stay lean. It's clearly shown that men, as they get overweight and in particular obese, the incidence of prostate cancer goes up just by being fat. So by trimming down and having a healthier lifestyle makes a big difference. The other thing that we strongly recommend for men is to eat a lot of antioxidants, blueberries, blackberries, pomegranates. That really makes a big difference in terms of, again, having anti-cancer against factors within our body. But the key is to minimize weakening the immune system, and a lot of that is to take the inflammation out of the body by avoiding meats and dairy as much as possible.
Doctor, what vitamins and minerals do you recommend for a healthier prostate?
We really don't. A lot of the vitamins and minerals that have been, again, supported out there, such as zinc and selenium, have actually shown in larger studies to increase the incidence of prostate cancer.
Oh.
So our recommendation to men is to actually have a very balanced, healthy diet. And as long as you're eating correctly, you really do not need vitamins to supplement. It's not necessary because you're getting them in your foods on a daily basis.
Well, and it's interesting. I mean, we've talked to others about gluten and how it prevents certain things from getting into your system. But again, that is still out with, you have those that say it is, some of those say that it isn't. But let's talk about those that actually now, no matter what they did, they're in this situation, or they have this happening to them, or it will happen to them. Right. There's obviously the question of, I know one of the first ones is sexual function, because it can it impact that? And if so, what is the process for that?
Definitely. So we can really take a page out of breast cancer and what women have actually gone through and what we've learned. So if you go back, say, 50 years ago, women who had breast cancer, they would all end up with a mastectomy, which is a complete removal of the breast. Whereas now, if the cancer is detected early, we can just do what we call as a lumpectomy, which is, in essence, just take out the focus of cancer and keep the normal, healthy breast tissue there. For prostate cancer, we've been dealing with a dilemma up until recently, which is if somebody has cancer, even if it's a small amount, a lot of times men would have their entire prostate removed or the entire prostate radiated. Or alternatively, we'd say, look, just sit tight, it's not big enough, let it grow until it becomes big enough, then we'll take out the whole prostate or radiate the whole prostate. So what we've been missing is the male lumpectomy, if you will. And now we have that technology. We're now able to identify a lot of cancers within the prostate with incredible precision. And now there's a new treatment modality that has been incredible. It's called HIFU, which stands for High Intensity Focused Ultrasound, whereby we're able to use harmless ultrasound waves and pinpoint exactly where the cancer is located and destroy the area of the cancer and leave the normal prostatic tissue and the vital structures, such as the structures important for erections and control urination. The beauty of that is that it's done as an outpatient procedure. You come in, you get it done, you go home, you can go have dinner the same night.
Wow.
Now,
nice.
the question that you asked, which is, look, if somebody undergoes whole gland treatment, such as removal of the entire prostate or radiation of the prostate, you're absolutely right. There is some very significant potential risk for the development of erectile dysfunction as well as loss of urinary control. And by being able to diagnose patients early where they can have focal treatment, which is just a lumpectomy keeping the rest of the prostate intact, the chance of having any degree of erectile dysfunction or incontinence is truly minimized, and it can be as low as 2 to 5%, which means that 98 to 95%, depending on the treatment that we choose, can preserve all of that function and at the same time be cancer-free in an outpatient basis.
Wow.
Wow.
Really
okay,
amazing.
Now I want to just tell our listeners again, we're here with Dr. Michel. He's the founder of the Integrated Prostate Cancer Center in Los Angeles, a facility that uses state-of-the-art technology and holistic treatment methods. Doctor, what are the other type of, when it comes to this holistic treatment methods, what does that consist of?
So there are a number of men, in particular in Southern California, and their family members that are interested to not only have Western medicine, which is what my expertise is, but they really would like to complement that with alternative approaches. And from a simple perspective, it's dietary support, nutritional support. Other people really would like to get involved in terms of acupuncture, Chinese herbology, as well as people that are interested in energetics and energetic healing. Even though that's not the thing that I have expertise in, we have a number of colleagues that are very, very skilled in these different medical art forms. And for those men that are interested, then we introduce them to them so that they can really be treated as a whole person. And if you take a look at an individual, we have the physical body, but there's also that psycho-spiritual element that many people really yearn to have also healed. And that's what we provide for them.
Well, I can appreciate that because sometimes we go to doctors, right, Brett and Mia, and you think like they're so on one side of the spectrum that they're not open to the other spectrum, and to me it's a little self-limiting. It's almost like the one side, which I understand, but in other words, what I'm saying is thank you for being more well-rounded out.
Right.
That's very kind of you. That's very kind of you. Thank you for that.
Yeah, because I'm sure you see it even among your colleagues, right? They're like, what was the thing that helped you? Because there's a lot of doctors that are just, no, that is alternative, so therefore it doesn't work. And then there's some doctors, including, there's a doctor that we interviewed. He was the one that Robin Williams played, and he's very much about alternative medicine as well. But what was your thing that kind of got you out, or were you always that way? Were you always open to alternative?
I've really been open to it, but I share with you that I think we have to have a little bit of hubris that, every different element is able to provide and is good for one aspect of your health. So I find that, so for example, someone comes with a cancer, Western medicine are very good at going inside and getting rid of that cancer, but there's another entire person and being and another way of lifestyle that has actually brought that person to this point. So for true healing, we need to be able to address those. And in Western medicine, even though we have expertise in one aspect of human health, if you will, there are other aspects that we need support. And I truly believe that the future of health is really a complementary, integrative approach to helping men. So I think that's just the way that I've been raised. And I just see the difference that it makes for men and their families by being able to just be whole.
Well, doctor, what are some of the signs of prostate cancer? Because some men are stubborn. They will not go to the doctor at all.
You're absolutely right, dear. The most important thing is that most men with prostate cancer have absolutely no symptoms, and that's the key. That's the importance of why people need to go to get screened. And what I was just mentioning to you is that if we wait until the prostate cancer actually becomes symptomatic, we've waited too long. So that's why it's super important for men to just have a simple rectal exam, a simple blood test. The entire evaluation can just take a few minutes, and that can just save someone's life. But if the prostate cancer is much more advanced, people can have one of the many symptoms, including blood in their ejaculate or in their urinary stream, difficulty voiding, pain within their bones, weight loss, lack of sexual appetite. These things can occur, but they can also be due to multiple other factors that can present the same way. But the best thing is get screened. Don't wait to become symptomatic because you may have just waited too long.
Well, Doctor, again, thank you so very much for being among the doctors that are well-rounded out. And that was Patch Adams I was talking about earlier. We had interviewed him, and he did believe in the same thing that you're talking about right now. And we've seen the influence and the ability he has to heal many patients of his own as well. And thank you. I'm sure you're also adding to that contribution of saving a lot of lives, but also making the quality of life that much better. Thank you so very much for spending time with us on the treatment. And how can people get a hold of you?
You can reach us at 310-278-8330, which is our office number. Otherwise, they can go to prostatecancerdr, like doctor.com, and we're more than happy to help out anybody who needs any assistance.
Prostatecancerdoctor.com. Thank you so very much, Doctor.
My pleasure. Thanks for having me on your show.